Dear friends, good evening to one and all. I am Dr. Arun, Senior Consultant Gastroenterologist and Hepatologist, practicing myself mainly in Chandra Gastro Liver Clinic and Endoscopic Center. Today I am here to discuss with you all an interesting entity and also a very complex procedure in the field of gastroenterology. It's nothing but ERCP. What do you mean by ERCP? It is also called as Endoscopic Retrograde Cholangiopancreatography. To make it very simple, I'll be discussing with you all a very simple clinical scenario. For example, this is your gallbladder, this is your pancreas. If there is any problem, if it is going to happen in and around this organ, you may need a ERCP procedure. What are the various problems you may develop there? You may develop a gallbladder stone. If you are going to have a gallbladder stone for a longer duration of time, there is high possibility for this stone to migrate into the duct, what is called as your bile duct. If the stone is going to migrate into your bile duct, you may develop multiple complications. For example, you may land up with fever, vomiting, abdominal pain, and high jaundice. Jaundice is also called as yellowish discoloration of your eyes as well as your urine. In case if you are going to land up with all this problem, you may deserve a ERCP procedure. Next to that, if you are going to develop a cancer in your gallbladder, or if you are going to develop a cancer in your bile duct, or if you are going to develop a cancer in your pancreas, or if you are going to be alcoholic, if you are going to consume alcohol for a longer duration of time in which your pancreas, if it is going to get shrunken off, you may develop a pathology what is called as chronic pancreatitis. If you are going to land up with these kind of problems, you may deserve a ERCP procedure. It's one of the complex procedure in which you need more experience to perform, and only in high volume centers you can perform this procedure. We are going to perform this procedure through endoscopic approach, in which you are going to place a tube. You are going to send a tube from your oral cavity into your food pipe, and from there into your stomach, and from there into your proximal small bowel. And once you have been entering into your proximal small bowel, we are going to identify a structure what is called as ampulla. In that ampulla, we are going to intervene if you are going to land up based upon your various problems. For example, as I discussed with you, if you are going to have stones, if you are going to have any cancer, based upon your various problems, we are going to intervene accordingly. If you have any doubts, feel free to communicate with me at any point of time. Thanking you all for patient listening.